Welcome back. You are watching The Front Row. Thank you for staying with us. Remember, on Twitter, we're asking you, how can Kenya navigate the mental health crisis? At Akisa Wandera at KT News KE, hashtag Front Row. I'll be sampling a number of reviews that I'm already seeing come in, so do keep them coming. You're part of this conversation, a larger conversation. My guests at this hour, Dr. Mercy Mwangangi, CAS Health, Dr. Frank Njenga, a psychiatrist, and Maureen Waititu, who's a content creator and mental health champion. Maureen, I'd bring it back to you because you've started by giving us your experience, but then we cannot shy away from the conversation around the cost of accessing mental health care in this country. What was that like for you?
Oh my. Akisa, let me tell you, let me just mention this before I even continue. Dr. Frank Njenga, I'm your patient, or a graduate, I should say. And Dr. Mercy Mwangangi, I want to commend you both for the work you're doing. Just hearing what you're doing and planning to do warmed my heart, because I realized that something that happened when I walked into the first hospital, it's going to become true. So, I was very lucky because when I got to the clinic at Chiromo Lane in Westlands, they did not ask me for anything. I was distraught. I was in tears. I sat down and I don't remember which doctor came, and he asked me a few questions and he assigned me to a psychologist at that time. And I remember I had an insurance card, but not at any one point was money to begin with. A disclaimer was an issue at that point, because you could tell that at Chiromo they wanted me to be okay, and then we can talk other things later. But I progressed and I had to see a psychiatrist later on, who I've been seeing ever since, and it's definitely not cheap. I will not go into the figures, but it's actually not cheap at all. But I can say it's worth every penny. And that's what made me start talking more about mental health, because I realized that people won't even get the first courage to step in. And I still keep telling them, you'd rather pay the price of a consultation and your medication, if need be, than pay for the price that comes with it. However, I know there are very many lines, which I actually have put on my Instagram, that are free in terms of anybody who feels like they're going through something, they can call free of charge. And I must commend, and I think there are almost 20 of them that are on my Instagram. There's a place I've written mental health, because I'm always searching for people who cannot access medical health like myself. And I mean, sorry, yes, access mental health and medical health like myself, and to access the best of the best, because I've been privileged to access the best medication, the best doctors. However, in terms of cost implication, it's a thing that makes people or patients shy away, because they always think, I cannot afford this consultation. And let's be honest, especially during the COVID times, it was not a priority. But I want to say that yes, it is expensive as a patient, and there are other options whereby if someone is not able to access that, there is also free help found, and that's why I do what I do.
And I began by talking about a number of stumbling blocks to this. And which brings me to my next question, Dr. Njenga. Maureen admits that it's not cheap. We all know that it's not cheap. We started by looking at some figures, even just the access, just a paltry number of hospitals give comprehensive mental health care services in this country. So from access and cost, would you say that this is also a big contributor to the spiraling numbers that we are seeing, and what are we doing about it?
I'd like all the viewers and anybody else who's interested to understand that hospital treatment is almost a sign that our systems have failed. People must understand that the best places to start acting about mental health is actually within the community. and amongst our families and amongst our communities and amongst our churches and mosques. The kind of support that is available within us is really the number one and the most important point at which interventions have to be done. Secondly, if one looks at the WHO pyramid of how things eventually have to be done, we have the local community, we have outpatient things, we have general hospitals, we have, by the time we get to the kind of hospital that Maureen ended up in, it's a sign that really what should have been done earlier was not done. And the advocacy by those who I believe know, and government as well, is that the idea should be to make sure that as many people get as much help before they reach the point of severe illness. And that is why we talk about prevention and promotion of mental health. And if I don't say anything else this evening, let me say that the most important strategy is one that involves prevention and promotion. By the time we come to training clinical officers and nurses in mental health, that is another level above that, long before we can talk about hospitalization. Having said which, it's also true what Dr. Mwangangi has said, that really we in Kenya spend 15 cents. It cannot even buy peremende on mental health, as opposed to the World Health Organization recommended 250 shillings. So if you use a little bit more of our resources to prevent and promote, we would prevent the expenses associated with hospitalization. That's my case fundamentally.
So what should be the ideal situation? Because you started by mentioning the community. I imagine immediate family, extended, then you go further to friends and the immediate surroundings, perhaps. So then when someone has a problem like Maureen's, to be instance, for example, what should be the first course of action before they get to hospital? Ideally, what should we be seeing?
When we went around the country as a mental health task force formed by the government, something very interesting and for me fascinating happened. When we talked, for example, to faith-based organizations, Christians, Muslims, Hindus, and so on, they made the very specific request for us in government to provide a curriculum that would enable them to better understand their congregants in terms of their mental health. One gentleman who remains in my mind said that sometimes he is confronted as a Qadi to superintend over divorce matters, and he can tell that either of the other party is depressed, but they don't know how to deal with depressed people. So they feel paralyzed. And right now, one of the things that are in our plan, and Dr. Mwangangi will be talking about this, I hope, is the training of people who provide spiritual health and care on how to recognize those people who are having problems within the community, to recognize depression, to recognize anxiety, to recognize schizophrenia, so that these people can actually be prevented from reaching where Maureen reached, because they get care at these lower levels. But, and this again is recognized, there are instances in which whatever you do, people will have to get into hospital situations. And I'm glad to say this, that again, government has taken this matter extremely seriously. We've all heard about the strategy for making sure that the Mathare Hospital is relocated, that we are able to provide to Kenyans a clean and dignified environment in which to receive care. In short, Maureen, the strategy is holistic, starting with the community all the way up to hospitalization for people who depend on government services and those like Maureen who can go to private care.
Dr. Mwangangi, I'd like us to talk about the workplace. For many people, it serves as a trigger for one reason or another. How do we address the issues around mental health care and wellness without any form of discrimination and victimization? Because we know as far as the workplace is concerned, there's a lot of work to be done.
Yeah, that's a very important interface when it comes to our mental health action plan. And I think just to follow on to what Dr. Njenga was saying, the idea is to be able to intervene in the normative spaces where people exist. So you spend about 8 hours at work, you spend another fair amount of time with your family, you spend another fair amount of time in church, you spend another fair amount of time in different entertainment sports, in gyms, in membership clubs. And so the idea is to put in place interventions in those spaces that actually, one, promote for awareness. There's a strong element of what we call self-awareness, individual self-awareness, that you require to seek this help and seek this support. And some of the things that we are working on when it comes to the mental health action plan is actually to train our teachers, to train religious leaders, to train and to put in place curricula in different workplace environments that actually enable, one, the identification of, hey, there's a problem here, we need to deal with it, but also that, put in place strategies that, avoid stigma and discrimination. And I'm quite happy, Akisa, we've just had a small conversation that the Standard Group does have a policy when it comes to, occupational and safety health. And this is a challenge to all people who are watching, those who are stewards of different companies. Do you have a workforce strategy in your company? In the Ministry of Health, we do have a document that guides us in terms of how we provide support to different officers. And this needs to then, of course, be devolved into all institutions, into all facilities. And so there is a role that everyone can play, particularly when we start at the community level. And I think another key important aspect, and Maureen mentioned this, when it comes to access, it's become, and I always make fun of this and say it's very easy for me to dial for a beer right now if I need a beer. But I'd be surprised to see if it's possible for us, to dial some form of mental health service. If you needed to talk to a psychologist right now, or if you needed some mental health service, and of course we all have our mobile phones and we have good mobile phone penetration in the country, how do we leverage on such technologies to avail, easy access to these services? And these are all elements of the mental health action plan. I'm glad that Dr. Njenga has emphasized that the work is in the prevention. The work is in avoiding, in avoiding sort of having a large number of people get into the hospital system and have to interact with the system. And so each and every one of us, perhaps if I could share with the country, we have just about 86 psychiatrists. Those 86 individuals who are very crucial and important surely would require the support of the Kenyan community for us to be able to fight this scourge.
But then even as we look at that and we look at the numbers that we currently have, just working on the prevention bit of it, how much work is going into this, considering there's stigma in these very communities that we are depending on to support this?
So one of the things that we're looking at is having people who've had the lived experience in terms of mental health problems. And that's why I'm quite excited to see Maureen here today. And through the different interventions and programs that we have in the Ministry of Health, we are actually bringing survivors of mental health disorders and conditions into our policy-making spaces as we design some of these programs, and even as we go ahead in terms of implementation. These are part and parcel of our thinkers, so that we can ensure that these policies are adaptable to the conditions, that exist. I think an important point is also ensuring that our school system, our education system, is programmed in a way where teachers are also able to identify cases amongst children, but also teachers have the needed capacities in terms of how they can provide support. And if we're able to ensure that there's multi-sectoral collaboration and engagement and resources put in these spaces, not just in the health system, not just in the Ministry of Health, but in the Ministry of Education, the Ministry of Labor and Social Protection, then surely we'll be able to make headway when it comes to, again, defeating mental health disorders in the country. I think another key important element is perhaps the role that, county governments play.
Yes.
And particularly right now, we're quite happy because in terms of the availability of these comprehensive mental health services, we have counties who are making investments in different health facilities. As mentioned by Dr. Frank Njenga, we are looking to devolve Mathare, so we will actually have 6 regional centers that can offer comprehensive mental health packages across the country, and this will sort of bring the services closer to Mwananchi. And then there's the foot soldier, who we often forget, the community health worker and volunteer. We now have a curriculum, and we're quite happy about this in the Ministry of Health, that we've developed a module where we're able to train our champions in the community in terms of how to identify these conditions, how to link clients or communities to care, and how to even follow them up. And so there's sort of a huge momentum building up and a lot of activities in this space to try and ensure that there's more access to these services.
Dr. Njenga, a number of concerns among Kenyans that perhaps spike some of these illnesses, I should say, high level of stress derived from, economic distress, high political environment, negative political environment. We're heading into a campaign period. We're looking at divisive elections, lack of jobs. We are right in the middle of a pandemic. We're not out of the woods yet. It keeps mutating, and it becomes stressful by the day. Looking at all these things that Kenyans have to deal with right now. And on top of it, we are heading into an election. We're about to get into a highly competitive political period that I imagine comes with a lot of anxiety. How can we navigate this? What do we need to put in place for Kenyans to be able to handle these immediate problems that we are seeing, from the pandemic to an election to an economy that is currently in distress?
I have some very interesting, some will say bad news, which is that there is no one quick fix. Mental health needs were there before Corona, they will be there after Corona. Mental health needs were there before elections, they will be there after elections. So much as we would like to say and blame Corona, blame elections and so on, the reality is that these are issues that demand our sustained attention over a long period of time, in part, and Dr. Mwangangi mentioned this, because of the stigma and discrimination that is associated with mental health needs before and after elections, with or without Corona, with or without financial difficulties. I urge and continue to urge that all of us, government, wananchi, people in the healing professions, that we allow ourselves to take a long-term view and say that this is a challenge that belongs to us, irrespective of our religious affiliation, irrespective of our political affiliation, irrespective of media affiliation. It's ours together, with or without all these challenges that we are seeing currently. With that approach, I think we can take a longer-term view of the solutions without blaming this group or the other one. So my urge tonight is that we have a problem that demands united effort over a medium and long-term nature. But those who are watching tonight, the responsibility of starting this, this war is yours and mine.
Right, and before we get into a break, we asked in our Twitter poll, how can Kenya navigate the mental health crisis? Chebet Birir, she's our reporter here, she says, inclusivity, include every member of the society in proactively raising awareness and normalizing conversations around mental health, from the children to the teens to youth and the elderly. Donald Lubemba says, I like the conversation going on, especially life experience shared by Maureen Waititu. I think mental health should be incorporated integrated in our curriculum to help young people overcome it? Keep the comments coming. I want us to take a quick break. We'll be back with the last bit of the show just before the top of the hour. Remember, our text lines are open to 22155. Do tell us how we can navigate this crisis. And of course, any personal experiences, we'd be glad to share it on the show. Let's take a quick break. We'll be back with more.